Hey guys, Eric from Chandler Physical Therapy here. Super excited to introduce our newest acquisition here. He's a physical therapy assistant. His name's Alex, and I want to take this time to let him introduce you to you guys so you know a little bit more about him.
How's it going, everyone? I'm Alex. I was born in Los Angeles, California. Moved out here in '95 when I was 13. I played football for Chandler High for 2 years and graduated from Mesquite in 2001. When I was 19, I enlisted for the Army. I was shipped to Fort Benning, Georgia. I was a combat medic for an infantry battalion, did 2 tours with them. Decided to get out, and I was activated as a reservist for a military police company when I was a sergeant, became their senior line medic. After my 3rd tour, wanted to stay in the medical field, so I decided to look into different aspects of the medical field and fell in love with physical therapy. Graduated from Pima Medical Institute in 2010. Been working outpatient ever since then. I'm really manual based, so certified in kinesiotaping, A-stem, in other forms like soft tissue mobilization, trigger point release, active positional release. So I come from that kind of background. So if you're treated by me, you're going to expect a good portion of the treatment to be manual based, and then the exercise and restoration per plan of care of the physical therapist.
Absolutely. So do me a favor, tell them a little bit about the differences between a physical therapist and a physical therapy assistant, because there's a lot of overlap, but there's also some differences.
Yes.
So
let's go with the big differences. A physical therapist assistant cannot treat a patient unless they're evaluated. So a physical therapist assistant is not able to evaluate a patient. A physical therapist has to evaluate it. With a physical therapist evaluating the patient, goals and parameters are set per the plan of care. And the physical therapist assistant now begins to develop that plan of care based on those guidelines. So a goal can be like general quad strengthening. So that can be a general goal. So the physical therapist assistant can do the treatments and progress or regress the patient as appropriate according to how well they're tolerating an exercise, and make sure they're not compensating, make sure they're getting good form, and ultimately them reaching their goals.
Absolutely. And what's really nice about this is that one of the big linchpins for us is that we have a hard time getting evaluations in. This will open up the physical therapist for evaluations that you can do some hands-on stuff.
Yes.
I've had you put your hands on me. Really, really talented as far as soft tissue and everything that way. So I love knowing people coming on board that have such a good skill set. So I'm excited for that. Tell me a little bit about dry needling though.
So dry needling, it just recently became appropriate for PTs to do it back in 2014 per the state board. Currently, PTAs are not allowed to do it, but if you are seen by me, I just have to coordinate it with a PT. Right. So I can do the portion of the treatment, which is the manual, the exercise progression, regression, the activities, and it's just my duty to talk to the PT so they can get it done, so the patient's not waiting for 20 minutes after their treatment. Absolutely. So sometimes if you are treated by me and dry needling is incorporated in plan of care, you might get it sometime in between an exercise, or maybe towards the end, or maybe even the beginning after the manual treatment. Yes. So we're just making sure that you get the best plan of care every time you come in.
Absolutely. And that's, something important is that, a lot of people come in strictly for dry needling. It's not that if they're working with you, they can't get it. It's just, we've got to coordinate with us.
Yep.
So super excited to have you on board, Alex.
Well, thank you.
If anyone has questions, please feel free to reach out to us, give us a call, but look forward to seeing this guy around the clinic.
All right. Thanks.